Do you have any trouble just getting buy-in from the other staff members out there that you have to work with, or is everyone on board from the beginning? How does that process unfold?
Yeah, so I stepped into this role with a significant amount of enthusiasm. I was eager to really spearhead initiatives and to enhance our emergency preparedness measures. And from day one, my goal was to introduce innovation and effective strategies that would elevate our readiness for any crisis. And it became apparent that change, especially in a high-stakes environment like a hospital, can be daunting. And many of the caregivers already burdened with daily responsibilities and the stress of healthcare delivery were initially hesitant about adopting new procedures. But I think gradually, as caregivers witnessed the benefits firsthand and experienced the improvements in our trainings and our emergency responses, their apprehension kind of gave way. And that journey towards full buy-in was gradual and required some persistence and a lot of training. But I think overall, it helped open up, again, that culture of preparedness and really looking for feedback, if you will, which was actively sought after and valued, which kind of like demonstrated the direct impact of our changes that we made into their professional lives.
So I'm sure there have been some unexpected threats or emergencies that have popped up for you and your team over the years. Do you have any good stories to share that illustrate how you responded and recovered?
Sure. So I believe it was about a month or two ago now, a Verizon infrastructure outage happened in our region, and it impacted 1,000 feet of fiber optic cable due to a lightning strike. We really identified that inbound and outbound faxing across the entire system was down. We had some overhead paging issues now. Interpreter services providers weren't able to use their normal hotlines. Patients weren't able to call into some clinics and get information or whatever that may be. So the way we kind of handle emergencies here is we bring together our hospital incident management team. And that core group of people consists of like the on-call nurse, the administrator on call, the chief of communications, myself, and then other key departmental stakeholders who are impacted by this. And we jump on a quick call and try to assess what's going on. I like to call it the who, what, where, when, and why of the emergency to kind of get an idea of what's impacted and what resources are needed. And then from there, once we kind of establish some of those impacts, like the Verizon outage, how we're able to identify that, then it's time to figure out, okay, how do we kind of continue normal operations? And if we have workarounds, how do we communicate that out to staff? And then how do we communicate that out to our patients? And we try to think outside the box and really leverage our technology. We leveraged social media postings, so letting our patients know, hey, call our main hospital number and they'll be able to transfer you to your specific department and things like that. And leveraging our all staff emails to really let them know, hey, this is impacted. Here are our workarounds. And we kind of established a battle rhythm for departments to also report into the command center to let us know of other impacts that may be coming up that we are not aware of yet.
What's your process for going back and assessing the lessons learned and then implementing all the necessary changes?
Sure. We, after every emergency incident, whether it's small or large, and then as well as any training or drill, we conduct an after action report. And we really gather all that comprehensive data, and which includes everything from staff reports to the timeline of events to resource requests. And then with all that data, we construct an agenda and address those specifics about that incident. And then we delve into what improvements could happen in the future and how we could have handled things better. And then from those discussions, we identify clear and actionable lessons. And when that happens, we develop that action plan, assigning those responsibilities to ensure that those improvements are implemented. I like to think the after action report isn't something that just gets filed away. It's actively followed up on and progress is reviewed in other meetings to ensure that those targets and objectives are kind of being met. So in the future, when we come across potentially the same incident, we know, okay, hey, we've dealt with this before. Here are what we ran into for problems. Let's try to avoid that process and move forward with what we have identified for a better solution.